Hello everyone, welcome to the new session of Symptoms of Common Disease in Cattle. So this is the third part of this particular topic. So in this session, we are going to study about PPR, that is also known as goat plague, bovine babesiosis, that is tick fever, that is commonly known as tick fever in cattle, milk fever, African swine fever, and calf scour. So these are some of the diseases that we are going to cover in this particular session. So let us start with PPR, that is the pest des petits ruminants. So this is the name of this disease. Okay, this is commonly known as goat plague. It is the most important viral disease of goat capable of heavy mortality and commonly called as goat plague. Okay, so this is one of the very common viral disease in case of goat, and they causes high rate of mortality, okay, in cattle, and this is also known as goat plague. So etiology of this particular disease, the causative virus was first thought to be an aberrant strain of the rinderpest virus. So earlier it was thought that there is another strain of a virus of the rinderpest, and due to that there is a disease in this goat. Okay, so earlier it was thought that it is caused by the rinderpest virus only. So that had lost its ability to infect the cattle. Later, molecular study shows that it was a distinct form that closely related to the rinderpest virus. It was related to the rinderpest virus, but it was another virus, right? So this is the another virus that causes goat plague, but it is closely related to this rinderpest virus. The clinical sign of the PPR in goats is often fulminating and fatal, although apparent infection occur in the endemic area. So this is endemic. Wherever this disease is spread, it causes lots and lots of mortality to the goat. So mortality rate is high in endemic areas. Incubation period may range 2 to 6 days in the field condition, and in acute form there is a sudden onset of fever with the rectal temperature of at least 40 to 41 degree centigrade, right? So when they are in open, okay, so the incubation period ranges from 2 to 6 days when they are in field condition, and in acute form there is a sudden onset fever in the rectum. And if we take the temperature of the rectum, this is the range of the temperature, that is around 40 to 41 degree centigrade. So the affected goat showed dullness, sneezing, serous discharge from the eyes and nostrils. So these are some of the clinical signs that we can see in the infected goat. That is, they show the dullness in their behavior, sneezing, very often sneezing can be seen, serous discharge from the nostrils as well as from the eyes. And during this stage, farmers often think that the animal has been exposed to the cold, right? And they provide protection from the cold, but this is not the thing in this case. After 2-3 days, the discharge lesion develop in the mouth and extend over the entire oral mucosa. So this discrete lesions can be seen in the mouth, and later it can extend to the oral mucosa region, forming diphtheric plague. So this is the severe case, diphtheric plagues. Okay. During this stage, a profound halitosis, that is the foul smell, is easily apparent ill and the animal is unable to eat due to the sore mouth and the swollen lips. So this happens to the goat, that their lips become swollen, their mouth becomes sore, okay, and the plaques are developed, that is also called as diphtheric plaques, okay, in their oral mucosa. And there is a foul smell that is called as profound halitosis. This is the stage where the animal is not able to eat at all. Later, ocular discharge become mucopurulent and the exudate dries up, matting the eyelids and partially occluding to the nostrils. So there is an ocular discharge from the eyes and become mucopurulent and exudate dries up. Okay, so matting the eyelids and eyelids become closed at that time and partially occluding to the nostrils, and nostrils also affected. Diarrhea develops 3-4 days after the fever and is profuse, and feces may be mucoid or bloody depending upon the damage. So their feces now become bloody. Blood comes out along with the feces, and there is a diarrhea develops within 3-4 days with high fever. Dyspnea and coughing occur later due to the secondary pneumonia. So lungs are affected, they are not able to breathe properly, and also coughing is there. Death occur within 1 week of the onset of the illness. So these are the different symptoms of the illness, that is dyspnea, coughing, secondary pneumonia, okay, the nose and eyes infection, soreness of the throat, okay. So all these are the different clinical sign of this particular disease, and later within a week the infected animal dies. Treatment and control. So no specific treatment is recommended for the PPR being viral disease. So it is a viral disease, so there is no specific treatment. However, mortality rates can be reduced by the use of drug that control the bacterial and parasitic complications. Okay, so there are some other parasitic and bacterial complications after the infection of this particular virus. So we can control that particular infection by the bacterial and other parasites. Okay, so mortality rate can be decreased at that particular drug treatment. Lesions around the eyes, nostrils and mouth should clean twice daily with a sterile cotton swab. So they should not be left in their situation. Their nostrils, their mouth, their eyes should be cleaned out twice daily. Immediate isolation of the affected goat from the clinically healthy goats is most important measure in controlling the spread of the infection. So if we do not want to spread this particular infection, the first thing we must do that isolate the affected goat. We should isolate that affected goats, so that the disease should not spread to the other healthy animals. Nutritious, soft, moist and palatable diet should be given to the affected goat. So this type of food must be fed to the affected goats. Provide parental energy infusions in anorectic goats along with the appetizers. So we must give some appetizers and also some energy infusions to the infected goats. Immediately measures should be taken for the notification of disease to the nearest government veterinary hospital. And the one thing we must do, that we must consult to the veterinary doctor nearby. Now, cause. That is for the... Now, the next disease is the bovine babesiosis, that is also known as tick fever, bovine babesiosis. So bovine babesiosis is a tick-borne disease of the cattle. So this particular disease is a tick-borne disease of cattle. Transmission of bovine bovis takes place by engorging adult female ticks pick up the infection. Okay, and they pass it on to their progeny via their eggs. So this particular bovine bovis, that is this actually it is a protozoan that is infected, that are infected by this particular ticks. Okay, the female ticks, and that also passes to the progeny via their eggs. So the larvae or the seed ticks then pass it on in turn when feeding to the another animal. So these larvae or the seed ticks are passes from one animal to the another. So bovine babesiosis is also passed from one generation of ticks to the next. Engorging adult tick pick up the infection, and the nymphal and the adult stages, not the larval stages of the next generation, passes it on to other cattle. So in this way, this particular species, that is bovine babesiosis, is also passed from one generation of the ticks to the next by engorging adult ticks pick up the infection, and the nymphal and the adult stage, not the larval stage of the next generation, passes it to the other cattle. So the nymphal, that is adult stages, okay, also passes this particular disease to the next generation, and they can infect to the another cattle. Morbidity and mortality vary greatly and are influenced by prevailing treatment employed in an area. So the mortality rate and the morbidity rate depends upon the infection, how badly a cattle is infected with this, and how we are treating to that, or how the treatment is employed to that area. So the previous exposure to the species, strains of parasite, and the vaccination status. So all these particular things determine the morbidity and the mortality rate. In endemic area, the cattle become infected at a young age. So when it is in endemic area, the area which is badly affected with this particular disease, so there the young cattle are also affected and develop long-term immunity. So the cattle become infected at a young age and they develop a long-term immunity in that. However, the outbreak can occur in these endemic area if the exposure to ticks by the young animal is interrupted or immunonative cattle are introduced. So if we introduce immunonative cattle to this particular area, then there is an we can control at that particular level. Okay, so the introduction of babesia infected ticks into previously tick-free areas may also lead to the outbreak of disease. So if any animal who is infected with the babesia infected ticks, okay, it is infected with the tick and that tick is infected with the babesia. So, and in a new area, that is tick-free area, tick-free area. So a new animal is introduced here where no tick is there for this particular disease. So a new animal is introduced in this area who is having this tick on their body. So this can spread from animal to animal in this area. So we must get ensured before introduction to any animal in a new area. Okay, not only for this disease but also for any other disease. Now the symptoms: high fever. So generally they are having high fever when they are exposed to this particular tick. Neurological signs such as incoordination, teeth grinding, and mania. So these are some of the neurological signs, that is incoordination. There is no coordination in their activity or in their body. Teeth grinding is there. Okay. Some cattle may be found on the ground with the involuntary movement of the leg. So there is involuntary movement of their legs and they can be found on the ground. So when the nervous symptoms of the cerebral babesiosis develop, the outcome is almost always fatal. So when it reaches to the cerebral region, that is cerebral babesiosis, okay, so this is affected to the nervous system, okay, and this is called as nervous symptoms of cerebral babesiosis. So when it reaches to this particular stage, the animal become almost fatal. So they are having dark colored urine. The urine discharge is quite dark in color. Anorexia. So there is no proper feeding. Okay, no proper feeding, and that is why they are having weak body. Okay, so appetite is lost, and due to that they are not having a proper feeding habit. Animals likely to separate from the herd, so they want to get separated from the herd. They become very weak, okay, depressed and reluctant to move. They are not able to move even. Sometimes they are very reluctant, okay, because of weakness. They don't want to move from one place to another. Effective control of tick fever. So how can we prevent? Okay, so effective control of tick fever has been achieved by combination of measures directed at both the disease and the tick vector. So there is an vector and there is a causal organism, right? So tick control by acaricide dipping. Acaricide dipping is widely used in endemic areas. Dipping may be done as frequently as every 4 to 6 weeks in heavy infested area. Okay, so this can be controlled in this way. Tick can be controlled in this way. The occurrence of resistance of ticks, chemical residues in the cattle, and the environmental concerns over the continued use of insecticide has led to the use of integrated strategies for the tick control. So the babesiosis vaccines are readily available and are highly effective. So we are having, for this particular disease, we are having vaccines. So we can have vaccines to our cattle. Anti-tick vaccine are also available in some countries and can be used as a part of an integrated program for the control of ticks. So we can have an integrated program. So if we want to control this particular disease, we can run integrated program for our cattle. And in that, we can have this anti-tick vaccine to our cattle animals. Babesiosis can be eradicated by eliminating the host ticks. So this particular disease can be controlled if we can eliminate the host, that is ticks. So in the US, this was accomplished by treating all the cattle every 2 to 3 weeks with the acaricides. So what is acaricide? This is a pesticide. This is a pesticide. This is a pesticide that kills ticks and mites. Okay, so this is very important. In this way, in the US, it has been controlled by treating all the cattle 2 to 3 weeks, every 2 to 3 weeks with this particular pesticides. So in countries where the eradication is not feasible, tick control can reduce the incidence of the disease. So this can be done to control the disease. So next is the milk fever. Okay, so milk fever, also known as parturient hypocalcemia and parturient paresis, okay, is the disease which has assumed a considerable importance with the development of heavy milking cow. So this is a disease which is also known as milk fever commonly, but it is known as parturient hypocalcemia. Hypocalcemia means lower level of calcium, and parturient paresis, okay, so which has assumed considerable importance with the development of heavy milking cows. So it is very important. Generally, this particular disease occur to the heavy milking cow, the cow that gives us lot of milk. Okay, decrease in the level of ionized calcium in tissue fluid is basically the cause of the disease. So there is reduction in the calcium in the tissue of cattle, right? So this causes milk fever. In all adult cow, there is a fall in the serum calcium level with onset of lactation at calving. So after they are having lactation for the calving, so the calcium level get reduced because all the calcium goes to milk, that is in the lactation. And when there is a serum test of this particular cow or a cattle, then there is a reduction in the serum calcium level. The disease usually occur in 5 to 10-year-old cows, and it is chiefly caused by a sudden decrease in blood calcium level, generally within 48 after calving. So this means after giving the birth for the calf, so within 48 hours there is a reduction in the blood calcium level. So that is milk fever. What are the symptoms? In classical cases, hypocalcemia is the cause of clinical symptoms. So first thing is that there is a hypocalcemia. Hypophosphatemia and variations in the concentration of serum magnesium may also play some subsidiary role. So hypophosphatemia means reduction in the phosphate level, serum and also the concentration of the serum magnesium, lower level of magnesium is also reported in some cases. The clinical symptoms develop usually in 1 to 3 days after the calving. So after the calving, there is a reduction in this particular calcium ion. Okay, they are characterized by loss of appetite, constipation, and restlessness, but there is no rise in temperature. So there is no rise in temperature, no fever, but there is a loss of appetite, means the cow is not able to feed. The cow is not able to take food or intake food properly. Okay, constipation is there and restlessness also. Okay, so next disease is calf scour. So in this particular disease, the calves may develop scores due to the bacterial or virus infection. So due to the bacterial or virus infection, the calves develop scores. Okay, and scores is also known as calf scores or the neonatal calf diarrhea. The primary cause of these scores includes rotavirus, coronavirus, cryptosporidium parvum, and salmonella and escherichia coli. So these are bacteria. Okay, these are bacteria, and the corona and the rota are the virus. These are the two virus. So bacteria and virus both causes calf scores. Determine if treatment is required. So the calves that are moving around in the pasture with their tail up probably do not need treatment. check to see if the diarrhea is yellow or white. So there must be a clinical diagnosis for this, that diarrhea, what type of diarrhea it is, whether it is a yellow or white. If this is the case, the treatment is probably not needed. Calves that are lethargic or not participating much in the playful activities with other calves are a red flag to pay attention to. So once the calf becomes lethargic and they are not playing, okay, so it shows that they are severely affected with this disease. So calves that are also losing condition are also cause for an alarm. So you can check for dehydration by pulling on the calf's neck skin. So if there is a dehydration, so this can be checked by pulling the calf's neck skin. So if the skin is tense, this is the sign of dehydration. Okay, so this is very important to check whether they are in a dehydration condition. A normal body temperature ranges 105 degree Fahrenheit, that is 38.1 degree centigrade, to 102.5 degree Fahrenheit, that is 39.2 degree centigrade. So anything outside this range is a sign for treatment. You will want to do this to avoid spreading the disease further. Administer fluid using your veterinarian approved electrolyte solution. So there are some electrolyte solutions. So after consult with the veterinarian doctor, we can provide this electrolyte solution. A drawback from providing shelter is maintaining infectious control. You will have to work extra to get rid of soiled bedding and disinfect everything that a calf will touch, because that thing is having bacteria and virus. Okay, so from the floor to the fence panel and even to the feed bucket, that should be disinfected. That should be done disinfected. Okay, so this is very, very important. Okay, so this is all about this session. Okay, we completed some common disease in cattle with this particular session. Thank you very much.